قلبي على جمعة الخير هلا حني قلبي على جمعة الخير هلا يا هلا ويا هلا ويا هلا ويا هلا يا هلا ويا هلا ويا.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum to the Saturday edition of Let's Talk with me, Julie Ali. I have a whole host of lovely young ladies that will be joining me in studio this morning. Razia Mohammed will be here to talk to us about NLP. She's a life coach and an NLP practitioner. So she's going to tell us what that means and how it can help you become a better version of yourself. Dr. Nadia Jajbai will be here as well. She's a radiologist and she's going to talk to us about cancers, specifically breast cancer. And I think she's coming in with a breast cancer survivor to share her story with us. First up, we're going to talk to dentist Dr. Zeenat Ahmad. She's here to talk dentistry and aesthetics, and I think that's going to be a very interesting conversation. So if you want to look your best, this is where you need to stay tuned. Assalamu alaikum, welcome to the program.
Walaikum salam, thank you for having me, Julie.
Okay, dentistry and aesthetics, it does go hand in hand, does it not? Because when I think, they often tell you that your smile really reflects your personality, and if you have good teeth, you're more ready to smile because you're comfortable and confident that you're showing off a very, very well kept teeth, so to speak.
Most definitely. They say statistically that the first thing someone sees when they look at you is your teeth.
Okay.
And naturally, if you feel good about yourself, you automatically portray a better image of yourself. So most definitely the two go hand in hand, and the way you look automatically illuminates in the way you represent yourself and the way you feel about yourself.
And if you feel good about yourself, you definitely do sparkle. There's a lightness and a brightness about you.
Yeah, most definitely. We all have that inner yearning to look our best and feel our best. And even though some people don't see what you see, or the inherent flaws that you think you might have, when you feel that those flaws have now through some sort of treatment disappeared, whether it be your smile, whether it be a little blemish on your face, you automatically then radiate that spark. Naturally it occurs.
Absolutely. Now, we're at that time of year where, I should imagine, young people have already applied for their courses at varsity and colleges. But for those that are still battling, and we do know that in the first few months of the year, you'll have a lot of dropouts and people changing courses. Mm-hmm. You're a dentist, a qualified dentist. You've been practicing for a couple of years. Why would you say that people should go into this field of study?
Well, dentistry is a very intense, very stressful 5 years. If you're not willing to sacrifice and dedicate and put in the hours, it would not be a suitable career choice to go into. When you're in first year, it's quite relaxed and quite chilled, but once you hit third year, you're now seeing to patients in addition to the academic portion of the dentistry syllabus. So there's studying involved in addition to seeing patients and meeting quotas. So it is a very, very stressful 5 years. At the same time, you've also got to be very artistic, very good with your hands. It's not just academic, as I've mentioned, it's working with your hands. So if you're a person who's got that natural flair towards art and also has the academic side, it's a very nice profession to go to, especially for ladies. My choice for dentistry was based on the fact that I was able to choose my times. I've got 2 little girls, so that works perfectly. I can still be a mom, still have a career, focus on both adequately, and dedicate my time both to my kids and my practice. So that's also a huge determining factor for females who'd like to go into the profession, because you can do both.
And I presume you run your own practice?
Yes, I do.
Okay, now let's talk a little dentistry and then we'll move over to the aesthetic side. Cosmetic dentistry is a big thing in this day and age. I mean, back in the day with my mom and my grandmom, etc., if you had a bad tooth, if you had a cavity, etc., there was no such thing as fillings or implants or whatever have you these days, or capping, straightening of teeth. Perhaps, those practices were in place, but it was not affordable. And then, of course, they just lost those teeth, sadly. And then dentures were a big thing back in the day. That's kind of almost archaic. It belongs to the old days, so to speak. Would I be correct?
Yes. So, dentists were considered the butchers.
Absolutely.
You have pain and they just pull out your teeth. Now the options are endless. You can do teeth whitening just, to give you that natural overall aesthetically pleasing smile without drastically changing or cutting into your teeth. There are veneers, which are your Hollywood smiles and your Bollywood smiles that everyone has, those super white teeth, those are veneers. There's crowns, implants. So like you mentioned, the options are endless. With that also comes the cost factor. A lot of people, believe it or not, in the socioeconomic climate that we're in, can't afford those things. So we still get the odd few that are using the dentures, believe it or not. Crowns are very costly. Implants themselves are costly as well. So as many out there that are doing the cosmetic dentistry, there's a lot that are still sticking towards the old-fashioned route.
And I also know that a lot of people who are on medical aid also have restrictions placed on the amount that medical aid would pay out for dentistry per annum, per family, etc. So you're correct in saying that only X amount would be covered, and if you want to go for the extras, you'd have to pay for it out of your pocket. But the results in most cases are amazing.
Yes, no, definitely. With regards to the medical aid, I think it's one of our biggest challenges. A lot of people come to you when they're now in such extreme pain and there's nothing left that you can do besides extract their tooth because of the limitations put in place by their medical aid. Many people can't afford the top options or the top priority medical aids, so they tend to stick to the lower option medical aids, and the brokers do not adequately inform them of what actually is covered by their medical aid and what isn't covered by their medical aid. And when they've got to now outlay this money up front, they find it very challenging, and many people then realize at that point, why did I choose this option of the medical aid? I mean, had I known better, I would have chosen something that now I can actually benefit from. So that is one of our greatest challenges. But those that do have the means and are able to pay for it, definitely they go for the cream of the crop.
Mm-hmm. In terms of, and I know that's not necessarily the field that you specialize in, but when we talk about cosmetic dentistry, it's what you alluded to, the Bollywood and the Hollywood type of dentistry. But what if people don't choose the top options? Let's assume at a very late stage in your life, you may be in your 30s, 40s, and possibly even beyond, and you've always wanted to fix your teeth. Maybe they're still crooked, maybe they're discolored. Is it still viable at that late stage?
Yes, definitely. I mean, we can do so much with ordinary fillings, filling veneers, if I can call them that, which are quite cost effective, and if the practitioner does it correctly and adequately, you can still end up with an absolutely beautiful result. Dentures for that matter, I mean, if they're done well, adequately, no one will even know that you're wearing a denture. So you don't have to spend a lot to yield a lot. You can get that end result with using cost-effective dentistry as well.
And braces for adults, that is still an option, is it not?
Yes, definitely. There are a lot of adults in my practice who either as a kid, their parents didn't find dental health important, or they didn't have the means to afford braces, which now in their adulthood still find that it makes them feel a little bit less worthy of themselves and go out and they do their braces.
Or horribly self-conscious.
Yes, definitely. But there's so many alternative means of braces now. There is stuff like Invisalign, where it's invisible, or you only wear it at night, or in the times that you're not interacting socially. You can put the braces behind your teeth. There are clear aligners.
Oh,
so
wow.
there's so many things out there that you can do, still have the benefit of the braces without the ghastly appearance of braces.
Mm-hmm. Without any discomfort, I should imagine.
Yes, definitely.
Let's talk a little bit about kiddies and dental care. What are you seeing children presenting? And I know that our kids are unbelievable as far as their diets are concerned, meaning that they eat lots of sugar. Is that impacting on the general dental health in a big way?
Yes, so a lot of the parents are under this misconception that their kids know how to brush correctly, or just because you tell them to brush that they're actually doing so. So I think it's our duty as parents to ensure and make sure that your child is brushing correctly. I do it with my kids as well. I mean, I don't take that, learning curve out of them and saying, I'm going to brush your teeth for you. I allow it to do it themselves, but I just check on top to make sure that they are actually getting into those spots, getting into the correct areas. You can't eliminate sweets from the diet totally, but everything in moderation. The time of the day that they're having these sweets, the amount, the consumption of fizzy drinks, I tell all my patients or parents of my patients that ensure that they're brushing first thing in the morning, the last thing when they go to bed at night. Very, very important. In addition to that, give them a chocolate as opposed to a fizz or a toffee. The chocolate's going to melt, whereas the fizz and the toffee's going to get hooked everywhere.
Right.
If they're having a fizzy drink, let them have it with their meal. Don't let them sip throughout the day in a little sippy cup, because in that way the saliva doesn't come back up to that buffering capacity and it stays in an acidic medium, and that's when we're seeing all those cavities. Bottles, or breastfed kids, don't allow them to suck on that bottle the whole day or the teeth the whole day, because even if there's no sugar, it still does cause decay.
Mm-hmm. Is it true that children who probably up to the age of 3 or even beyond have these pacifiers or drink out of bottles with a dummy, that they're actually damaging their bite?
Yes, that's correct. So even sucking on the thumb, these habits tend to elongate the jaw and make huge orthodontic problems later on in life. So as soon as the child is of age, try and wean them off the bottle, wean them off the dummy, just to help that jaw to develop correctly, and we don't end up with later on having these huge orthodontic issues.
Finally, on children, apart from, let's assume that the kids' teeth are healthy, there are no cavities or anything, how often should you take them to the dentist just for a checkup?
Ideally every 6 months. Even if the child refuses to sit in the chair. It's more about building a relationship with them, doing little things before we can get to the big things, so that when they actually do require big things, they're comfortable with you and they're sitting in the chair and they're happy to actually have those procedures done, as opposed to having a child screaming and kicking their parents before they even reach the door.
Absolutely. Yeah.
And there are very safe ways of, like I personally do conscious sedation, so if there is work that needs to be done on them, we can do it in a very atraumatic way where there's no emotional scars left to take them into adulthood.
Okay, there you go. I'm talking to Dr. Zeenat Ahmed. We're talking dentistry. After the ad break, we're going to talk the link between dentistry and aesthetics. So do stay with us. Dr. Zeenat Ahmed is in studio. Talk to us about dentistry, and we're now going to talk about aesthetics. It's a practice she's involved in as well, but it started way back when she was a bit frustrated, simply due to skin tone. We're going to ask her to share the story with us, and she's going to talk to us about the link between the two, dentistry and aesthetics. How did that journey start for you? Did you ever think that you're going to be having a mixed practice, so to speak?
Not at all. I think it wasn't even on the back of my head. So I was looking at my skin one day in the mirror and I was like, I'm just not happy with the tone and the texture and the color of my skin. So I decided to see a dermatologist, and I was so disappointed when I got there. She looked at my skin and she said, your skin's been damaged by the sun. There's absolutely nothing we can do. Just use some sunscreen. And I was despondent and I was like, no man, I can't just accept that as an answer. So I decided to see a second dermatologist, and I went to her and she had a look at my skin, and even though I have no acne, she gave me something for acne and a few cleansers and said, go use this for a couple of months and I'm sure you'll be happy with the result. And that's what I did. A couple of months down the line, I realized I still wasn't happy. So I decided to dig in a little bit deeper and see what is out there. What can I use? What can I do to make my skin just look a little bit better? And the first thing I came across was the green peel.
Green peel?
Yes.
Okay.
And
you Googled this, obviously.
Yes, I Googled it. And I got in touch with the company and I said, hi guys, I wanted to know a little bit more about this product. So they came to see me and we chatted a little bit and they said, but do you know that dentists are doing aesthetics? You can do this. And I'm like, oh wow, really? Okay. So I decided to go for the training and practice.
Did you try the products first before going for the training?
Yes, I did. I did it myself.
So tell us about the results. What is it that you use? Because as I sit here with you, your skin is glowing. It has a beautiful glow.
Thank you.
It's very even textured. So how did you start off? How long did you wait to see the result you were expecting and possibly hoping to see?
So with regards to the treatment on myself, I was mostly the guinea pig. Every time I wanted to implement something new in my practice, I practiced it on myself, or the reps themselves would practice it on me. I'm currently using a brand called Biomedical Emporium. It's relatively new in South Africa, pretty much about 3 or 4 years old. It's made in South Africa by a doctor called Judy Pretorius in Pretoria. So she makes the products herself here in South Africa.
Is she a dermatologist?
She is a biochemist.
Oh wow,
yes.
Okay.
So she's got actually quite a few degrees behind her name and quite a few PhDs. She started off with baby products and a few other pharmaceutical products and now has decided to go into skincare exclusively. The product is recently available internationally as well. So I started using the peels regularly and the take-home products. You know, it's so important that the two complement each other. You can't just be doing something at home or doing something in office and expect to see results. You know, it's like a husband and a wife. They need to work together. So the combination of the two then has improved my texture. I won't say I'm religious about it. I'm actually very bad with these kind of things. But from time to time, at least, you know, nightly, I tend to follow my routine quite to the core, the procedures, you know, put in a serum, put in a moisturizer. And within a couple of months, generally, it takes between 8 and 12 sessions before you start seeing a change in your skin.
Now, you talk about sessions. Are you talking what you do at home on yourself, or is there an option to go into possibly see someone like you or go into one of these clinics and have them perform the actual
Yes, so correct. The sessions would be your in-office procedure, whether you do it with an aesthetic doctor, whether you do it with some beauticians that do these type of aesthetic procedures. Those would be the sessions. They would generally fall a month apart unless you suffer from acne. We generally recommend a little bit sooner with acne. And depending who you see and what products they use, they would then advise on what home care you can use to complement the in-office session.
And the in-office sessions, is it just a program of 12 treatments, or can it be, if you can afford it, obviously, an ongoing thing that you'd go there once a month or once a couple of months?
Always need something. I mean, in your teenhood, your concern is acne. In your pre-adulthood, it might be pigmentation. As you get older, into your mid-30s, 40s, it might be wrinkles. So our skin is a very demanding organ. I think there's never a time that you can come to and say, I don't need any treatment. I'm totally 100% happy with my skin. So if it's a specific concern that you're dealing with, after 12 sessions or 8 sessions, when you're happy, you can stop, but you're more than welcome to then continue to maintain and prevent further issues. I think it's always about prevention rather than cure.
Okay, so tell us about what is it that you use and why you would recommend it to other people.
So I do a combination of peels. I do Biomedical Emporium, I do DermaQuest, the green peel, I do redermalization,
You need to explain what all of that is.
Okay.
And if you use the different products, what sort of result are you going to expect?
So each peel is specifically designed for a particular condition. So if you have an acne, there's a peel specific for acne. If you have pigmentation, there's a peel specific for pigmentation.
And how often do you have to use it?
Generally once a month. The peels are once a month. If you have more severe skin conditions, such as acne scarring, we can incorporate things like microneedling. That's where you would use a pen, a derma pen, to then inject, or rather not inject, but infuse certain good, beneficial therapeutic products into your skin to invoke a particular cellular response. So like the acne scarring, you would inject then collagen and retinol to stimulate the collagen production, to stimulate your skin cell turnover, to allow a new platform to develop and eliminate those scarring.
Does that mean then that the scarring will over time minimize or disappear completely?
Correct. So
I'm talking severe scarring.
Yes, definitely severe scarring. In combination with, you can use hyaluronic injections or redemilization injections, where you're just injecting collagen into the skin, because in essence that's where your scarring comes from, the damage to the collagen network underneath. So you'll never see results overnight.
So those injections you're talking about is only for severe scarring. What else can you use them for?
Scarring, acne scarring, areas of pigmentation where you want to lift the pigmentation. The reason we lift it is then to use a peel to remove those superficial layers and to break it up. And also just for overall skin tone, enlarged pores, texture, wrinkles.
Women are more prone to these type of treatments because, as we've said at the opening of the show, we want to feel good, and the way we feel good is because we know we look good. If you know you're looking good, you feel good, obviously, or vice versa. What about men? There are men who have issues around scarring. There are men who, because of regular shaving, I think the skin does get damaged, I presume.
Yes.
Men too have skin problems like us girls. So what do you recommend for them? Would the products that you use on men be slightly more hardy, perhaps? Because their skin is tougher, I seem to think so. I don't know, I could be wrong.
So men are a little bit more hesitant and more resistant to seek professional treatment for whether it be their teeth or their skin for that matter. So the resistance of the skin is a little bit tough, but the protocol is pretty much the same thing.
You don't have a different range for men's skins?
There are certain brands that have a different range, but it comes down to the core ingredients, and the core ingredients are in essence the same. So the end result would be the same.
Mm-hmm. And you do have men coming for treatments?
I do have a few, yes. Not the majority, definitely the minority, but there are a few.
You spoke about needling. What exactly does that do? When would you use it? How do you use it? Is there any pain involved? Any sort of discomfort perhaps with the needling? I know about needling with pain, to reduce pain, back pain, etc. How's needling used on the skin, and what sort of results can one expect? So
we use a device called a dermapen or a micro needling device. You also get derma rollers, which you yourself can use at home. The depth of the needle varies. You can manually control the depth of the needle. But in essence what it does, it tricks the body into believing that it's been traumatized or hurt, and as a result the body's natural healing process kicks in and it starts stimulating new cells. And that's in essence what we're doing with microneedling, tricking the body to say, let's produce new cells, new healthy cells. And in conjunction with that, you're incorporating good beneficial serums, so when those new cells are being replicated, they're being replicated in a healthy way with good products. In terms of pain, look, I've done needling myself without any anesthesia, and it's honestly not that painful. But a lot of people, when you say needling, already the fear, strikes them. So we do put a bit of numbing cream on prior, generally about 45 minutes prior to the procedure. We do a quick peel, a superficial peel, just to remove the dead skin cells, followed by the needling. So it's not painful at all, really not.
Now I'm imagining in my mind, I'm seeing, the person sitting in front of me with a whole host of needles all around their face. Is that what it's all about?
So it's a little pin, and at the tip of the pin there's these little needles, and you run the needle across the face. So
okay.
No, we're not putting a whole lot of needles into your face.
Is needling done specifically for acne scarring, for acne, or if you have a relatively good skin, you don't really have major problems, what is the needling going to do for you? How will it benefit you?
It's basically going to stimulate new cell production, so healthy cells. You can use needling for every possible skin condition and under the sun, from acne to scarring to pigmentation, and in addition, just for premature aging, just to help with that little tweak in your skin, to give you that little extra glow.
Oh, great. We've come almost to the end of the interview. In closing, What do you have to say to our viewers, very especially the ladies out there, if they want that glow and if they're wanting to get rid of those telltale wrinkles, would needling and these peels that you talk about do the trick?
Yes, good skin doesn't just happen. You need to book an appointment. I mean, see your aesthetic practitioner, see your dermatologist, whoever you're currently seeing, speak to them about your concerns and let them tailor-make a specific treatment plan for you that's, no one is the same. Everyone's needs, concerns, and conditions are different. So the only way you're going to see those results is if you actually start being proactive in it. Make that appointment and use your products at home. Use good products. You can't expect to see the most expensive aesthetic practitioner and be using Dove soap on your face. Mm-hmm. The two don't work together. Invest in your skin. You will see the results, most definitely.
And of course, you can't go and see a practitioner expecting overnight results. You have to work at it. You have to be patient. And possibly after a couple of weeks, you definitely will see the results if you've been good at doing what you're meant to be doing at home.
Yes, 100%. Even though histologically there's a change in our skin after the first session, we're not going to see it, from the eye perspective. It does take time,
Finally, lots of people say, very especially when you're working on the skin, that you're going to possibly get an outbreak or the skin's going to look worse before it actually looks better. Do you believe in that? Is that in fact what happens?
Sometimes, yes, it does, especially with the more deeper peels. You do go through the horrible 7 days where the skin gets much darker. Also, you do peel with the more deeper peels. With the superficial ones, you don't. So the skin can appear more red, more inflamed, darker. You could possibly have a breakout with certain type of treatments that are done. But it's not because the treatment induces it. Your skin cell cycle is every 28 days. So that blemish or little pimple that was meant to come out in 28 days time in any case. We've just sort of speed up the process. So you can go a little bit worse before you do get a little bit better.
So that is expected.
It is expected.
And finally, sunscreen, do you swear by it?
Yes. You live by it, you use it every second of every possible. It's the only thing that's going to protect us from the harmful rays of the sun and also from the free radicals that are produced in our skin.
And that's where we leave it. Thank you for being with us on the show. You've been absolutely delightful.
Thank you for having me.
And given me a lesson that I need to continue taking care of my skin. And there you have it, Dr. Zeenat Ahmad. She's a dentist and an aesthetic practitioner. She practices from Bedford View in Johannesburg. And you can, of course, consult with her if you want to have a beautifully glowing skin like the one she has. Still to come on the show, we'll be talking with Dr. Nadia Jajbai about cancers, and we're also going to talk to Razia Mohammed about coaching and NLP. So do stay with us. And welcome back. I'm so pleased to say that I have two gorgeous women in studio with me. The one is a radiologist, Dr. Nadia Jajbai, and the other one is her beautiful patient, the lovely Asima Musa, and she is in recovery from breast cancer. She's just used terminology off air. She says it's DCIS. We're going to ask them to unpack it because it's the first time I've heard of this condition. Breast cancer is what we're talking about, and survivors of cancer is what we're going to be looking at in this segment of the program. So let's welcome the two lovely ladies in studio. Dr. Nadia Jajbai, assalamu alaikum, welcome to the program.
Wa alaikum salam wa rahmatullahi wa barakatuh. Thank you for having me today.
Thank you for sharing your valuable time with us. And Asima Musa, I can't thank you enough for coming in to share a very personal story with us. Assalamu alaikum.
Wa alaikum salam. Thank you very much for having us here.
Your story is going to touch people in a very special and in a very big way. You are very brave to come in and talk about it so openly. And alhamdulillah, you are going to, by way of your story, give a whole host of women out there and even men suffering from different cancers, you're going to be giving them hope. Alhamdulillah, may Allah subhanahu wa ta'ala accept all of your efforts and all your du'as, inshallah.
Ameen, inshallah.
Nadia, it starts with you. You are a radiologist based in Killarney, Johannesburg, and people come to you for mammograms. Oftentimes, alhamdulillah, you tell the patient that you're clear, everything's absolutely clear from the last time I've seen you, you're good to go. But then there are times like when Asima came to see you, I presume, get a bit of a shock as well, because it's not what you want to see. You are a doctor, you are there to heal and help. But it's your job also to find anything untoward, then to hold the patient's hand and to refer them on. Talk us through that process.
All right, Bismillah ar-Rahman ar-Rahim. It's very challenging to be in the position that I am, but with that challenge comes hope and the beautiful bright side, which is the humanity of what I deal with on a daily basis. I do screening mammography. So the screening serves for the purpose of early detection. So patient can come in completely well, has no symptoms, a lump or a discharge or anything like that, presents themselves and says, all right, I'm here for my screening, I'm in the age of risk, so can you just check for me? So we do the mammogram. I also do the triple test, which includes a physical examination and the ultrasound. While I'm doing that, a very dedicated, personalized type of interaction with my patient, I'm going to then have a look at the history and clinically examine the patient to see what risk factors that patient presents with. And the early detection is specifically for this condition which you mentioned, which is ductal carcinoma in situ. The mammogram being the gold standard because it's the only modality that we can confidently pick up DCIS in its early stages. What's early stages? So ductal carcinoma in situ, in layperson's language, is pre-cancer. So it's not invasive cancer yet, or breast cancer as we know it yet. There are abnormal cells that are now latent in the breastfeeding duct. That is the tissue of origin, okay, or the cells of origin. It's not even a tissue yet. Within those cells, little microcalcifications form. And the beauty of X-rays, we pick up calcifications on X-ray, okay? So when they're in a certain pattern, we suspect that the diagnosis can be there. The patient has no symptom. There's nothing palpable, so I won't feel any lump on examination. When I do the ultrasound, I will not see those calcifications. Unless it's more advanced, then we start seeing signs and symptoms of this. Okay, and it often is painless. Mm-hmm. So this is the beauty of the early detection and doing mammography. A lot of patients are very anxious and they say, well, you're doing an X-ray on me every year or every second year. Will that not give me cancer because I'm exposing myself to X radiation?
And that's the exact question I asked you when I came to you, because I'm a patient of yours, yes. Obviously. Please, for the benefit of the viewers, how did you respond to me?
All right. So, see, when we are prescribing anything, and I consider myself, and it is, a prescription of X-ray to you. I prescribe Panado, I need to know that if I'm going to give you paracetamol for whatever reason, the benefit of giving it to you for your pain of your headache or whatever you're taking is not going to outweigh its risks. For most people, that's going to be true. There are the minority. I've had 1 or 2 patients who are allergic to paracetamol, and that I need to know. And I say, look, in other cases, I'd give you this. We need to look for alternatives. Now, in the general public, and this is by protocol, by research studies, by studying sensitivity and specificity, the mammogram is still the gold standard. And why? Because the benefits completely outweigh the risks. Now let's talk about radiation dosage. When we compare radiation dosage of the mammogram, first of all, it's only localized to the breast. The scatter radiation up here to your thyroid, where some people say I need to wear a thyroid shield, or must I cover myself so that it doesn't affect my ovaries? The scatter radiation is minimal. You can't compare it to a chest X-ray even. But now let's see where we're going to compare it to. We're going to compare it to environmental radiation.
Right.
So take a plane, an aeroplane, from Johannesburg now to Cape Town, and you're going to get more environmental radiation to yourself, then you're going to expose yourself in the mammogram at that time.
What about cell phones, microwave ovens, etc.?
These are real radiation sources.
And we've got it next to our phones, next to our ears all the time.
And the worst thing you can do is put it on your clothing or on your person. Put it in your pocket here. No, please. Not in proximity. Same thing, you've put something in the microwave. You're not going to stand there and watch it do its job. You've got to stay a distance because these appliances and technology do emit radiation.
Actually, I have news for you. We do. I stand in front of the microwave to check that the milk's not going to overboil or whatever it is that I have in there is starting to bubble. So we are exposing ourselves at all times. Let's talk to Asima. You are a patient of Nadia Jajbai. Nothing untoward was going on in your life. You just went for your regular checkup, I assume.
No, actually, I had a class at home. We were doing hijab support, and I happened to be just sitting on my couch, sipping a cup of tea, and I felt this lump. So I called a friend of mine, Dr. Fatima Baba, and she called Nadia almost immediately. So I went in because I'd found a lump on my breast that I actually thought was a coin that had slipped into my clothes. And I was sitting there digging through my abaya trying to find out how this coin had got into my bra. And it turned out that it was a lump. So that's actually how I got to see Nadia.
And prior to that, were you self-examining and did you go for regular mammograms?
Okay, just to give you a bit of history about me, I lost my dad to colon cancer.
Oh, I'm sorry.
I'm one of those people that's very religious about what I do. I mean, I did colonoscopies every 5 years. I see my gynecologist every year for a pap smear. In fact, the year before I saw Nadia, I had a mammogram done at Sunninghill Hospital, which was one of the things we discussed in that first consult. She said to me that it's impossible that it wasn't detected the year before.
Because of the size of the lump?
Because of the extent of the calcification. So I was very religious about stuff like that. And that's one of the things that people need to realize, that you can be that person that does everything you need to be. But cancer doesn't discriminate.
True.
You know?
Were you angry? When you angry, upset, disappointed?
None of that. I was more afraid. And when I say afraid, I don't mean afraid for myself or my mortality or anything like that. I was afraid for my children and I was afraid for my husband. That's where my fear stemmed. I mean, the hardest thing I have ever done in my life is telling my children that we don't know what was going to happen next.
How old are they?
At the time, they were 15, 13, and 11. Alhamdulillah, 14, 12, and 10. So it's been 3 years, and alhamdulillah, we've come a long way. I think as people, all 5 of us in our household have changed, and that's a good thing, you know.
And your husband, his reaction when you said to him that you've detected a lump and you're probably going in for you're going for a mammogram to Nadia?
So he was traveling at the time, so I actually went in with friends for the very first visit, and I remember talking to him through that night before, and he kept saying to me, you know, you're overthinking this, women find lumps all the time, it's going to be fine. Fayaz is the sort of person that doesn't like to know that there's not good news. I mean, he doesn't deal with bad news very well. So he kept saying to me that night, I remember speaking to him till the late hours, and he said, I promise you it's going to be nothing. You're overthinking this. You're going to be perfectly fine. Women find lumps all the time. They're just going to tell you that it's just an odd
benign,
mass. It's
possibly.
benign.
Okay, let's go for our first ad break. I have 2 gorgeous women, as you've seen, in studio with me, Dr. Nadia Jajbai and Asima Musa, talking about cancers, breast cancers, the doctor and the patient. Please don't go away. We're going to talk some more right after the ad break. We're talking breast cancers, we're talking mammograms, we're talking about how women should self-examine regularly, and if you do find something untoward, then you need to make sure that you have it checked out then and there. That being said, Nadia, simply because it is said that breast cancers, if detected in the earlier stages, are very curable.
Yes. So we talk about 5-year survival in cancer survival. If there's early detection, so we find you in stage 0, which is the type of DCIS, stage 1 or stage 2. And
Asima was in stage?
Well, that's
At that point?
complicated. At that point, we didn't know.
Okay.
We'll unravel as she gives us her story. But women found in stage 0, 1 or 2, the 5-year survival can be up to 95%. In stage 0, 100% of women are alive by 5 years. Okay. It also depends. What I wanted to put light on, that we very much look at the body and about the physical being and about the scientific findings of what we are evaluating. So we give it a name, DCIS, all right, and you're in stage this or stage that. Remember, the staging has to do with the extent in the entire body, not just within the breast, okay? But I'd like to mention that our body doesn't coexist on its own. It doesn't exist on its own. It coexists. A very strong part of, and Asima has touched on it, a very strong part of it is our emotions, our spirituality, our support system forms part of that. And our will to survive and say, I will not let this beat me. I will not. I need to stay alive for my children. I need to stay alive for myself. Allah has given me this life. I'm not ready to go, and I'm going to try my best. I will commit to treatment. I will do this, and I can see myself surviving it. And this is the beauty of what I deal with on a daily basis.
Alhamdulillah.
This is the beauty of what I see.
When it was found that you are in fact presenting with breast cancer, what were you thinking? Despite the fact that your husband, that first night, you guys talked through the night possibly, and him reassuring you that everything's going to be okay and you're overthinking this. At what point were you told that you are in fact presenting with cancer, and what was going through your mind, your life ahead?
So it was exactly a week later that I did a biopsy, and Nadia had the results ready for me the following Wednesday. But Fayaz travels a lot, so he was back that Friday, and we went to see her on a Friday afternoon at 4. And I still remember walking out of her rooms after I chatted to her, and she said to me, look, it's not good news, it's what we did suspect it would be. And Fatima was on the phone immediately saying to me, these are your appointments. You're seeing this person at that time.
Wow.
Your appointments start at 9:30. So I didn't have time to digest it. At the time, my kids were writing exams. I had no intention of saying anything to them. All I needed to do was to figure out what the way forward was. And one of the things that we had decided as a family was to make Umrah that December. So we were booked to leave on the 16th of December. And then we visit the oncologist, and he says to me, you must be smoking your socks if you think you're getting onto that flight. So I had an emotional meltdown in the sense that for me, Umrah was my fixer. There was no surgeon that was going to sort this out. I was going to go for Umrah, and between me and my Allah, we were going to fix this. And I sat there. I'm quite a clinical person, and I'm the sort of person that tells more than listens. And I sat there in his room saying to him, so I'll be back on the 5th of January. We can schedule the op for the 6th. And he said to me, hell no. You are going in next week if I can get you a theatre booking.
What did you do?
Burst
Stand
into
your ground.
tears, threw a bit of a tantrum. And he said to me, he said, you know, Asima, if I wasn't a Muslim man and I was telling you not to make this Umrah because I didn't have Iman in my heart, then you can argue with me. But I'm telling you that if you make this trip, say goodbye to your children. You're not going to live to see the year out. And that was difficult for me. Having someone tell me that I'm not going to survive
if you don't undergo,
if I don't do the treatment immediately,
right,
was the most frightening thing. Nobody wants to be told that your life could be ending in the next
Look,
day.
we all know that two things are predetermined by Allah subhanahu wa ta'ala. It's our birth and our death. But as human beings, we are so frail, we are so egotistical that we believe, I think in the back of our minds, we would love to outlive everybody or just not die off.
Absolutely.
And I think that is very frightening. Nadia, knowing you, knowing the person you are, obviously you form relationships with your patients. They're no longer just a number. They're real people and their lives touch you in a very big way. How do you deal with the fact that you've got to break this type of news to Asima and a whole host of other patients?
It's a very vulnerable state at that time. because you know that you're going to affect that person's life for the rest of their lives. You're giving them, this is a game changer. Absolutely. This is one of those things that once said, their life will never be the same again. It can't be.
Of course. You saying that to me.
Right. And it's amazing what some of the survivors will come back and say, you know, this stuck in my mind what you said. So I'm very careful about what I say. Certain things I have to say. So a patient at that time is so shocked, they cannot digest a lot of information. You cannot tell them, now we're going to do this and we're going to do that, and overload them with information. In fact, the shock is immense, and it's always helpful to have a significant other there that's going to listen from a different point of view and absorb some of the more technical and the more challenging things that are going to go way above them, because they cannot believe you've just given them unbelievable news.
They've tuned out already.
Yes, yes.
Asima, Alhamdulillah, you are in remission as we sit and speak here. What is going through your mind, and how have you dealt with all of that? And it's traumatic. You went through a very, very traumatic time in your life. How did you deal with it going forward?
I have an amazing support structure. I always say to people that one of the most important things you should have in your life is a sisterhood. And I have the most incredible friends and the most incredible support from my family. So without them, I don't think I would have survived. My children changed as people. I think we forget to be absorbed in each other's lives. We're so absorbed in ourselves and in social media. And my children changed completely after this experience. And alhamdulillah for that, because I love the change in them. So I survived, and I saw purpose in living through them and through my friends. I can't even explain to you the level of support.
How do you believe you've changed?
I've decluttered my life.
Alhamdulillah.
And I think I needed to do that. I remember just before my 40th birthday, I was planning this massive party. And I remember Fayaz saying to me, we'd rent out landlords and do this huge party. And I'd sat down and I put together a guest list, and I'd ended up with about 400 or 500 people.
Ooh. And
he said to me, darling, I'm sure that if you go through that list, you'll find the 50 that you really want there. Declutter. That was my problem. I've had lots and lots of friends and acquaintances, but I didn't have a tight circle.
Right.
Or I didn't appreciate a tight circle. And I think cancer taught me that. Cancer taught me to close my circle and to that everyone wasn't important, and pleasing everyone wasn't necessary.
And it's okay to say no.
And it's okay to say no.
Okay, we've got about 4 minutes left to wrap up time. 2 minutes to you, Nadia. Your strong message to women, and very especially people like Asima. What do you want to say to them about this process that some women have to go through?
All right, so just to clarify, because viewers might be a little bit confused, we're talking about early detection, DCIS, and then with Asima having more signs and symptoms of something more advanced. She really is an exceptional case, and these things do happen. She is an exception to the rule. In her family, there's also genetics involved. And what I'd love to say is that we are on this beautiful journey of life. Okay, we get one chance at it. And nobody's going to look after you if you don't look after you. You are your priority. So whatever screening and health issues you need to deal with, you have to surpass that fear of what the possibilities of the outcomes are and say, well, you know what? The ignorance isn't bliss. I'm going to do what I have to do. That's all I can do. I can only try my best. The rest I have to put my tawakkul in Allah. Absolutely. Because He's the one who's sending this to me. He has promised me. He's promised me difficulties in life, with my children, with my health, with my wealth. He said He will trial us like this. So when He says He comes true on it, He wants to see what our resilience is, what is our response in this, who do we turn to, what do we do? And this is where I say we don't acknowledge just our body. We are not a DCIS, we are not a breast cancer. We are these beautiful creation of Allah subhanahu wa ta'ala, and we're going to say, Ya Allah, you gave me this, now you help me take this away.
Allah does tell us with every illness there is a cure, and with every hardship or every burden comes an ease. Allah has promised us this in the Holy Quran, Alhamdulillah. You indicated that your life changed, that you decluttered in every possible way, I suppose mentally, emotionally, physically. You have decluttered. Do you feel a sense of lightness?
Absolutely. You know, one of the lines that resonate with me is Anwar al-Awlaki said in one of his lectures, the life of a mu'min was never intended to be easy. So if your journey is easy, you should be concerned with your connection with Allah. And I firmly believe that. I firmly believe that whatever comes your way, Allah gives you as a gift. He doesn't give it to you to hurt you, He gives it to you as a gift. And
to bring you closer to Him.
And to bring you closer to Him. So disease comes to cleanse you. So when you get a gift that beautiful from Allah, you embrace it with both hands and you say, how can I fix what's wrong with me right now? And I think that's what cancer did for me. Helped me fix so many things that were wrong with me.
Very quickly, your message to women in your position, women watching us this morning.
Do the tests, be religious about it. Genetically related cancer is such a common thing, and people forget. You forget about that aunt that had cancer, and you forget about that uncle that had cancer. It's important to test regularly and find your purpose and be prepared to fight to live. I mean, my purpose was my family. My husband and my children were the reason I wanted to survive, and I needed to survive. So find your purpose.
And may you grant to be stronger with each passing day, inshallah, with all your loved ones around you. Thank you for sharing with me, both you wonderful ladies, and I'm in awe of both of you. So go well with much love and du'as. Shukran very much for being here.
Thank you.
That was Dr. Jajbai, Nadia Jajbai, and the lovely Asima Musa talking about her journey through cancer. Pity we don't have more time. I'd like to have dug deeper, but inshallah next time around. Still to come, Razia Mohammed to talk about coaching and NLP. And welcome back on this gorgeous Saturday morning with all of these gorgeous women in studio with me. Razia Mohammed, who is no stranger to ITV, is a life coach, and she also is a practitioner of NLP. We're going to unpack this modality, understand what it can do for you. Is it truly everything it claims to be? Does it truly make you become a better version of yourself? Razia Mohammed, Assalamu alaikum. Welcome to the program.
Salam. Thank you so much for having me.
Well, it's important stuff that we need to be unpacking. Razia, I know you've been a life coach. You've been in the space for a very long time.
Yes.
I also know that you are a CBT practitioner. We've talked about that in the past. And now you are doing NLP programming.
Yes.
What is the difference or the similarities between the two programs? Why would people come to you and learn this way of perhaps interacting or using this way in changing their behaviors? Because that's what it's all about, is it not?
Exactly. It's all about change your mind, change your life. And as we've spoken many times before, if you change your thinking, you'll find everything around you just falling into place and changing. So I started off doing CBT, which is cognitive behavioral therapy. And that basically speaks to your conscious mind. So when you are speaking on this level to your conscious mind, yes, the training is effective, but my personal opinion is when I was fortunate enough to discover the NLP, Neuro-Linguistic Programming, that kind of, I would say, attacks your subconscious mind. We are all products of our past, of our experiences, our circumstances, our childhood that shapes us into who we become ultimately, until you meet someone like me that shows you how to do it differently. And that is the NLP method that works so super effectively.
Now, you've done CBT for a very long time.
Yes.
What if someone comes to you and says to you that I want to learn how to engage CBT in my life? Would you try and make them change their minds?
Yes, I would. Because in 2008, I was exposed to NLP, Neuro-Linguistic Programming. And I found that I actually met someone who was on the stage at a Cecil conference, and he had energy of 5 people. And when I spoke to him, I said, I definitely need to talk to you. And he said, yes, I could see that you need to talk to me. And I said, what is it that you do? And he said, I'm a life coach. 2008, life coaching was something unheard of in this country. It was just
beginning to break into our environments.
There we go. And I researched it, and I did the life coaching course and the masters, and then recently the advanced one as well. And it all falls under the NLP modality, which I find is super effective, because if you do it the CBT method, where you're talking to the conscious mind, yes, you can make changes, but there is a distinct possibility that you will go back to your old ways of thought and ways of action. You know, it's thoughts, it's behavior, and then it's action. So when you do NLP, we kind of going into your subconscious mind. So when I say close your eyes, breathe, and I let you do the steps where I just ask you questions, we are actually going into your subconscious mind, which in actual fact is where you need to be in order to change the way that you think.
Who would want to, I'm a regular girl in a regular job, leading a very regular life.
Yes.
Why would I want to change? Why would I come to you to undergo this program?
So I get people that come to me and say, Rosia, I just want to be normal. And then for me, it's what is really normal, because normal for you and normal for me is 2 different things.
And regular for me and regular for you is 2 different things.
2 different things, because we grew up differently. We have different experiences and life's processes that make us into the individuals that we become. So who is really normal? And when you think that you are normal, you are kind of going through the motions over and over and over again. So how you behaved when you were 10 will be the same how you behave when you're 40, because your subconscious mind spews out an automatic response to whatever the situation is. That is why I say to attack the subconscious mind, and then it kind of goes into a shock and suddenly you start behaving differently, because you are now making it aware that whatever that action is not working for you. So I get loads of clients with anger management, stress management, goal settings, time management. All of those things play such an important part in your regular life.
How will this enhance relationships going forward? And how many sessions would I need to undergo to see a different version of myself?
An more awesome version of
and
yourself.
how the people around me are going to respond, because they're going to notice changes in me, I should imagine. So that's a whole host of questions I've thrown at you.
Yes. So you cannot change anyone. You can only change yourself. So I cannot change you, but I can give you the tools to change yourself. And once you change your behavior, you will find everything changing around you. I get clients that do my 7-session program, and that is mandatory. In order to get some sort of a change, you've got to do the 7 sessions.
Of NLP?
Yes, of
NLP. An
NLP.
hour long?
45 minutes each.
Okay.
7 sessions. And that is mandatory to get you to a positive space. And then going forward, you decide how often or when do you want to come again, because life doesn't stop happening, just your reactions are better, and the way that you analyze things will be better.
Now, I'm thinking, and you will respond to my people around me, how they would behave to the changes.
Yeah.
We'll get to that in a minute. I've had years and years and years of conditioning to the product that you see sitting here in front of you.
Certainly.
How is 7 sessions of NLP going to make me behave or think and behave differently?
Behave differently. So that is exactly the way it works. It's not like a normal counseling session where I will just sit there with my notepad and you say, when I was 5, this happened to me and blah, blah. What will happen is I will make you close your eyes. I'll kind of take you right to your past. And a very interesting story, I had a client who was terrified of water. She couldn't even watch water on the television. It would just freak her out. And she came to me, and what happened was we took her back to her past. So when I say past, it's from the time you were in your mother's womb right up to however old you are.
But I won't remember that.
I think I've known you for so long. I've done so many of these talks with you. I need to give you a complimentary NLP session.
Inshallah, I'll take you up on that. I definitely will take you up on that.
You need to personally experience
it.
this.
Okay.
I had a lovely, I'm kind of going all over the place now, but there's so much I want to tell you, is that I had a...
Let's finish the story with the women and the water, the phobia for water.
So what happened with the woman is she did the NLP sessions with me, and what we discovered after that is that when the mum was expecting her, she almost drowned. And she kind of transferred the negatives to this baby. Okay. And the baby came out being terrified of water. And then I kind of cured that fear of water.
And she's good to go now.
And she's good to go. She's good to go. She sent me a picture the other day of herself in the shallow part of the beach, sitting and being quite calm about it.
The response of the people around me, obviously, like you say, you can't change anyone.
Yes.
But giving me the tools of practicing NLP is going to make me a different person. I'm going to behave differently with people.
Certainly.
And they're going to respond to those differences.
Yeah.
They're going to ask me what's going on.
Of course.
So what do I say to them?
So what happens is that normally you would have a reactive stance, okay, to the opposite person, your daily person that you're with every day, or whomever it is that you constantly have conflict with. And now you will suddenly behave differently. So if you and I are friends and we have conflict all the time, now I do NLP with Razia Muhammad, and suddenly I am not reacting to you. So you are coming at me with your spear and your arrow, and I am not reacting. I'm reacting calmly. So the first time you may come at me, the second time you may come at me, and the third time you will be, but there is no audience. Mm-hmm. So this person is not reacting. Yeah. This person is not feeding my negative behavior with more negative behavior, and that will make the person respond differently towards you.
So be the change you want to see around you.
Be the change that you want to see in your world. I get clients that come to me that say, did you speak to my husband or my wife or my son, daughter, whoever? And I said, but I don't know your husband or your wife or whomever. They said, but they're behaving very positively towards me. I said, it's not, not that person, it's you that are behaving
And I should
positively.
imagine as a life coach and an NLP practitioner, whatever is discussed and shared in those sessions is absolutely confidential. So how can you possibly share even if you want to do? All right, let's go for an ad break. Razia Muhammad's here talking to us about NLP. We're trying to unpack it. We're trying to get our minds around what is this new phenomena that seems to be taking the world by storm. NLP, it is about changing your self or subconscious beliefs about you and the world around you, and just make you become a better version of yourself. So like me, if you've always been curious about what NLP is all about and what is this modality that people are raving about all around the world, Razia is here to tell us about it. Now, Razia, would this be a one-on-one session or a group session?
With yourself.
Anybody who's wanting to
I can
engage.
do one-on-one NLP, and I can effectively do group NLP. I can even do NLP without you even knowing it. Just by my words, my tone, my actions. I just came back from an all-ladies cruise that I organized this weekend. It was amazing. We had such a beautiful time. And I did sessions on board the MSC cruise liner. And I'm going to be doing one early next year as well, an all-ladies cruise.
Oh, good on you.
And it was amazing. And what I had done is, when I talk to you, the way I'll say things or the messages that I convey through you is some sort of NLP as well. So when I'm faced with some confrontation, and if I react in a calm and positive manner, the person opposite me suddenly calms down as well.
What about, and we know that this is played out a lot in our community. We're in a very patriarchal community.
Yes.
And our men, I guess the way they were socialized, just have a certain way of talking down at their women.
Yes.
Would this serve our women well if they underwent the program?
Yes.
But not their spouses. The spouses are the ones that are aggressive.
That are aggressive.
Are we going to see changes if the women go for NLP and start practicing it in their lives?
Most certainly, because the woman now will start reacting more in a positive manner. Because in a spousal situation, what I do find is it's very much about tit for tat. So if you tell me this, I need to say something double to you, and I need to react to your behavior. Anger is only you giving the person your power. So when you react to someone, you kind of putting yourself on a silver platter and you're saying, there you go, you control me. And you do not want to give your power away. So you do, in order to not give your power away, it's about mastering the art of calm.
Okay. You indicated to me earlier on in the interview that you take the person back to their childhood.
Yes.
Let's assume I'm a very angry person.
Yes.
You need to go right back to possibly when I was in my mom's womb to try and figure out what is it that triggers this anger in me all the time. I can never be calm. I'm just a very angry person at everything around me.
Yes.
Isn't that very private? How is that going to work in a group setting?
If something like that, I would not let you verbalize. So if I say like something as private as that would probably be a one-on-one session. A group session would probably be a self-image or a calming session. I wouldn't let you do negatives to that extent in a group setting. So,
and to share such private information.
To share because everybody is not out there to just share their private information. We're all very private people.
You've also talked about 7 sessions.
Yes.
Let's assume I come to you for 7 sessions and I don't want to continue because I kind of get the hang of this.
Yes.
But I should imagine there's a lot of homework involved.
Yes.
And do you give out literature for, the clients to possibly practice going forward?
I give out literature. I give you access to me anytime. So once you've done the 7 sessions, it's not like if you got to ask me a question, you have to book a session. So I give you access, and if somebody calls me and says, I need to talk to you, I've hit a stumbling block, you're more than welcome, and then I will talk you through it again to say, remember, we did this process, we did that process. Now it's about, you can't take the horse, you can take the horse to the water, but you can't make them drink. And then I make them drink by themselves. So it's very much about ongoing support as well.
What is so magical about this process that, and I think I've put the question to you earlier on as well, was that we have behaved in this manner from birth.
Yes.
And for 40, 50 or more years, we've known no other way of reacting, responding and behaving.
Yes.
What is so magical about NLP that in 7 sessions I can start being almost a new me?
Well, it's a very structured process. When I say 7 sessions, I've worked out a program. So it's not deliberate, like every 45 minutes is going to be super effective to your subconscious mind. So I will give you processes and I will give you tools and I will work on your subconscious mind in such a way that by the time the 7 sessions are over, you will feel differently. I guarantee you by the 2nd and 3rd session, you're going to feel out of sorts, because it will be all that you knew for 40 and 50 years. And here the strange woman comes along and suddenly challenges your status quo. So it will be, your subconscious mind will basically be like as if it's been dipped in ice cold water. So it's kind of a shock. And they do question me, but why am I feeling so overwhelmed? Why am I feeling so negative? Why am I feeling like something's missing? Because something is missing. What I've done is I've taken all the negatives out of your subconscious mind, and it's kind of now in the atmosphere. And now with session 4, 5, 6, 7, we are taking positive thought processes and kind of inserting it into your subconscious mind. That's how I can explain it as best. But the best form of advertising is experience.
We've talked about a regular girl like myself.
Yes.
You've used the term a normalcy or normality. That you can become a better version of yourself. You'll just be people, I guess, if you are a better version of yourself, you'll be attracting people and good things to you. What you put out in the universe is what comes back to you. But what about those very negative, very angry people who believe they've got scores to settle?
Yes.
My mother-in-law, father-in-law said something to me 20 years ago and that score hasn't been settled yet, etc., etc., etc.
Exactly.
How does that all play out?
Well, what we do is, if now, for example, now this person is completely angry with their mother-in-law and they want to settle the score.
Or angry, be born angry, perhaps.
Generally angry. So it will start off with me going to the source of the anger, very much in your first or your second session. So your first session is very much the way you and I are speaking. And I would end of the session with a very calming NLP activity. Make you close your eyes, imagine a calm space and just go there. So that's already me teaching you a tool. When life gets the best of you, go into your space and just be calm. And then your second session is where we start off completely with anger management. And
regardless of whether you have anger issues or not.
Well, by the first session, it's just that I've been doing this for a very long time. So in the first 5 minutes of meeting someone, I already know what you need. So a lot of the times I get people that are not congruent in their speech and their actions. Is like 2 different people. So you'll get this woman across from me and she'll be like, life is beautiful and everything is so lovely and I've got this and that and that and the other, and the body language is telling me something completely different. And then I would know exactly this is what you need. And then I would give them realizations. Okay, so everything is all well and good and honky-dory. How do you deal with this then? And then shock comes in and we start the process.
There never is enough time when I have you on the show. We've got about 2 minutes to wrap up time. I'm wondering about, we're talking about accessing the subconscious mind.
Yes.
You are going to get those people who are so strong-willed.
Yes.
And you're not going to be able to break through.
Yes.
And they are determined not to change certain things in their life. They're going to push back.
Yes.
How do you deal with that? Are you able to break through?
I am able. Sugar, I haven't had a client yet that I haven't been able to break. what I would do is, and normally people come to me when they are ready. There's no one that will come and sit across from you unless they want to challenge, and that's coming from ego.
Or manipulate you.
Yes, and that is coming from an ego space, and that's automatically I break down the ego space.
Okay.
So I deal with corporate, lots of corporate, and I get the CEOs of a company that will have that patriarchal way of thought. You are a woman, what are you going to tell me that I don't know? And I would basically assess you in 5 minutes and maybe attack the vulnerable part of you. So, for example, how long have you been dealing with an inferiority complex? This is a hypothetical situation. Regarding your dad, how long do you feel that you never measure up? So I kind of go with the shock factor, and automatically the defenses break down.
All right. To wrap up then, let's end off on, well, it is about positivity.
Yes.
It is about a better version of yourself. It is about getting the best outcomes in all of your relationships and all of your interactions with people. Because we're living in an angry, busy, stressful world. So this is going to serve us well. Age groups. Let's look at target age groups. I'm wondering if this will work with teenagers, for example.
Anybody from the age of 11 to 90 can be my client.
And why a young person as young as 9 or 11, for example?
9 or even 9. But from 0 to 8 or 9, I would prefer play therapy, because then you get through them better, because you can't have the strange woman saying, okay, so tell me what happened in your past.
Right.
You'll get a non-reaction there.
Right.
So I would say from the age of 10 up to the age of however long a person can live. My oldest client is 76 years old.
And all because that 76-year-old wants to have a better quality of life,
Certainly.
to enhance his or her relationships,
Yeah.
to get the best outcomes possible.
I don't know if there's a minute to just relate a quick story.
Please go ahead.
So I was doing a stint on SAFM, and this man called me and he said, you haven't advocated God, you haven't spoke about God even once, but you were advocating God, and I've got to meet you. And he came there and he met me. I was quite surprised because on the phone he sounded younger, and he was about 70 something years old. And he said, you know what, I want to do your 7 sessions. So I was curious. I said, why? He said, for 76 years, I have been pleasing people. I have been living life for other people, and now I want to live for myself for however long God keeps me in this world. After I did the 7th session, I got a good shouting from him, because he was like, where were you 40 years ago when I needed you? And then to something more, him and I have become the best of friends. He still visits me. He'll relate the stories to me, and he's totally calm. And he asked me, he said, that book of yours, do you have an English version? And I said, yes, of course. And I quickly got the English version of the Quran and I gave it to him. And a month later he said, please, there's a lot of things I don't understand here. Can you refer me to someone, or can you do it? I said, I wouldn't do justice. So I referred him to an imam, and he reverted.
MashaAllah. And may you be really and truly blessed with all of the goodness in the way you touch people, inshallah. And just carry on that light and that flag as high as you can. Thank you so much for coming in studio.
Thank you so much, Julie.
Lovely
Thanks for
talking
having
to
me
you.
again.
My pleasure. That was the lovely Razia Mohammed. She is a life coach and, as you heard, an NLP practitioner. It is a process, a modality that can change your life for the better, whether you have problems or not, whether you're an angry person, whether you're whatever it is, the issues are that you're carrying around with you. Here is something that can definitely make you start thinking differently, so that inshallah you can get better outcomes from all of your relationships. And that's where we will leave it this Saturday morning. A very big thank you to the Let's Talk production team, and to you. Take care on the roads. Until the next time, as always, it is Assalamu alaikum and Khudafiz from me, Julie Ali.
هلا ويا هلا يا هلا ويا هلا ويا هلا ويا هلا حن قلبي على جمعة الخير هلا حن قلبي على جمعة الخير هلا يا هلا ويا هلا ويا هلا ويا هلا يا هلا ويا هلا ويا هلا ويا يا هلا ويا هلا ويا هلا ويا هلا